Hello, my name is Nat Josephine Hall, and in this presentation, I'll be discussing about human immunity. I'll be covering with the following topics. So, we will look at the first and the second lines defense with a specific example. I will explain regarding the third line defense, sensitivity to antigens, including the rules of different types of immune cells. I will explain self-recognition, tolerance to own tissues, rejection of transplant organs, and describing two specific immune system disorders. I would also describe the categories of acquired immunity, including natural, artificial, passive, and active, explaining the immune response to vaccination, and discuss the concept of herd immunity, benefit of vaccination with the factors affecting vaccine uptaking. In conclusion, I would evaluate the benefit of vaccine. So, on the first line, which consists of physical defenses against diseases like skin and mucous membrane, also been release of chemical substance and their substance from the injured cells. In the second line involves such as inflammation, fever, phagocytosis, complementary proteins, cytokines. So it's what's happening in our body is the immune system trying to avoid bacteria, viruses, fungi, and parasites to enter in our body. The skin is compromised of three major layers: the epidermis, the dermis, and subcutaneous. So the first layer, which is waterproof barrier, and initially mechanically against invaders. The second layer is the middle of the skin, which contains many specialist structure, such as blood vessel, nerve endings, and hair follicles. The subcutaneous layer is the deepest layer of skin, which is made up of fat, connective tissue, larger blood vessel, nerves, and had a function to protecting the body. Mucous membranes are chemicals, barrier, and physical. So it's the surface of our eyes, ear, nose, sinuses, mouth, throat, GI tract, respiratory tract, urogenital tract, and vaginal tract. They are primary interface between the external and initial environment of our body. Mucous membrane helps our body to remain healthy by following good nutrients through while defending any infections. So, our system produces secretion which fight microorganisms and form a defense against infections. The chemical secretion releases by skin and mucuses which avoid the growth of microbes on their surfaces. It happens when the pathogens could not enter in the body and cause disease. So in the second line of disease is against infection and sickness. The body tries to protect itself by also boosting the blood flow to the contaminated area and after releasing protein and white cell like macrophages which engulf and digest bacteria and other foreign particles. So we can see on this what happened. The inflammation area become red and warm, become painful, and began swelling. So when we look on the immune system cell, this happens when the defense against infection and disease in the body, it compromises innate immunity, antigen and identify body's capacity able to react to particular foreign substances. Our immune system studied antigens from our environment and begin to create antibodies to protect and help against them. So we have five different types. We got neutrophils are the most common type of white cell with levels of 40. We got lymphocytes, a small round cell that have a large nucleus. We got monocytes are the largest white blood cell and their function is phagocytosis, such as macrophages circulating in our body. Eosinophils are important cells in relation to allergies and worm infestation. Their function is to releasing toxins to kill pathogens, mainly parasites and worms. Basophils are the rarest of the white blood cells and secrete anticoagulants, which are blood thinners and antibodies that act against hypersensitivity reaction as well as histamine to help against allergic reactions. So, immunoglobulins are proteins that are bound to antigens, simple terms as A, D, E, G, and M. Their function is to target infection, recruit immune cells, neutralizing toxin, removing antigens, complement activation, stimulation of phagocytes, and also activation of mast cell. They are made up of 4 chains. They are 2 heavier and 2 lighter with a variation in polypeptide. So when we look about the letter A has an important role in the cellular of defense of mucous membrane to the body, for example, in our mouth. D has function as an antigen receptor for B cells. E increases response to parasite infections and allergic reactions. G is a molecule is able to transfer across the placenta to a fetus, which provides some protection from pathogens it cannot have encountered yet. M has different structure than the other immunoglobulins. It is comprised with 5 normal immunoglobulins joined. Self-recognition is when the capacity of the body able to identify and accept its tissue. So the immune system experiences antigen if the MHC, known as major histocompatibility. There are 2 sets of cell surface proteins. The first one is molecules which they have been degraded them into fragments and allow them to be identified as foreign. And the second one is a highly difference which is act as an extracellular presentation already present in antigens from extracellular pathogens. So in this stage, the body is able to identify and refuses its tissues while rejecting foreign tissue. So hypersensitivity, it generates 10,000 cell types, each of different responses, especially to a foreign antigen. B or T cells are produced to become active against self-antigen. There are 4 major categories. We got immediate, antibody mediate, immune complex mediate, cell mediate, which is excessive immune reaction. Rejection of transplant. A transplant which possible rejection from our body. There are 3 different types. So we got hyperacute. This happen after transplant when antigens are completely unmatched. So in this situation, they have to remove it immediately. Acute rejection identified after a week to 3 months after transplant with some measure. Chronic rejection is when the body's immune response against the new organ slowly damage over many years. So, I'm going to talk about autoimmune disease. is when the immune system attacking our body instead of protecting it. Scientists have studied and do not know they have studied and do not know the reason why this is happening. They know about over 100 autoimmune diseases. Autoimmune diseases start attack begin to weaken any part of our body and even turning life-threatening. They may cause a variety of symptoms including pain, tiredness, nausea, headache, rashes, skin diseases, dizziness, and many more. Unfortunately, the expert scientists did not know the reason why our immune system could attack our body. It seems it doesn't recognize the difference between the healthy and the unhealthy cells. So when we look about rheumatoid arthritis, it's one of autoimmune disease of the joint and muscles. It's when our immune system attacks the tissue lining the joint on both sides of our body. It may affect other parts of our body. The exact cause is unknown. Treatment may include lifestyle changes, more exercise, diet changes, medication, and surgery. So we got a few common symptoms can be fatigue, fever, pain, weakness. We got the risk of factors. There could be family history, sex, smoking, obesity. It can be diagnosed by a professional healthcare referring you to a physician. They will examine you and ask you about your medical history and concerning about your symptoms, and followed by blood test, MRI, ultrasound, or X-ray. So medication for treating this, there are many, but there are many medications to decrease joint pain, swelling, and any inflammation. May include products like ibuprofen, naproxen, aspirin, and we got some medications such as methotrexate, which is a disease-modifying anti-rheumatic drugs. Surgery may be an option to restore function to damaged joint if your pain is not controlled with the medication. So the second autoimmune condition is multiple sclerosis, which damages the protective cover around the nerves. This is called myelin and located in the central nervous system. It may cause muscle weakness, vision changes, and memory issues. Unfortunately, there is no cure for it, but another option treatment is available to decrease an ongoing damage for it and manage symptoms. There are 4 types of multiple sclerosis. So there is clinically isolated syndrome, relapsing remitting multiple sclerosis, secondary progressive multiple sclerosis, primary progressive multiple sclerosis. So the symptoms could be dizziness, fatigue, loss of balance, difficulty with bladder regulation, memory issues, mood changes, muscle weakness. Risk of develop smoking, low level of vitamin D, exposed to a virus, obesity, genetic. Risk factors could be age from 20 to 40, Northern European descent, and assigned female at birth. Complication could be memory loss, depression, difficult walking without assistance. It can be diagnosed by a professional healthcare referring you to a physician. They will examine you and ask about your medical history and symptoms, followed by blood tests, ultrasound, X-ray, and MRI. Medication treatment for it are corticosteroid and then some injections into your skin, infusion, oral medications. It depends type of. They will advise you and look the best medication for your treatment. So it has been advised by the professional healthcare to adapt a lifestyle as regular exercise, balance, change of diet, sleep 6 to 8 hours, taking care of yourself mentally, physically, and do regular checkups. So we will look about vaccination. Vaccination has been introduced as an antigen into the body to provoke an immunological response. It could also obtain artificial immunity. The response is mediated by different immune cells, including B and T cells, which produce antibodies. So, benefit of vaccination, further of risk. As we can see, in the UK in 1968, measles infection were a huge spread since introduced vaccination, decreased measles infections. Sorry. So we can see there have been a huge difference between those time and nowadays. Herd immunity is a recommendation that when a sufficient people of a community receive a disease vaccination, it helps to protect those who do not vaccines. When we look about the factors affecting vaccine uptake, such as cost, maybe they couldn't receive vaccine because they are currently on treatment, religious belief, some people believe that vaccination can cause autism, they might think vaccine can cause more harm to them, misinformation, a lot of many things could happen. So if you better have a vaccine, you protect yourself from other diseases and other infections. That help you a lot. Nowadays, a lot of children have been saved their lives because thanks of vaccination, thanks of any measles, any rubella, any type of diseases. At those times, there weren't more information about vaccination, so a lot of people were dying at that time. But thank God, nowadays everything has been sorted out. We got help from vaccination, so we can prevent from catching any infections and diseases. So, in conclusion, human immunity is an important system, as we saw it earlier, which helps the body to protect from infection and disease. In this presentation, I have been provided an overview of the three main components of human immunity: non-specific defenses, specific immunity, and vaccination. We look on inflammation, fever, the function of macrophage, acquired immunity and sensitivity to antigens, self-recognition and tolerance of own tissues, rejection of transplant organs, immunological memory have all been covered. I have covered particular immune system conditions such as multiple sclerosis and rheumatoid arthritis. I have also discussed the benefit of vaccination and the concept of herd immunity. Through this presentation, it is clear that understanding human immunity and the importance of vaccination is the key to protecting the body from infections and diseases. We have to prevent from catching up any disease, and the benefit of receiving a vaccination is to prevent, and it is very important to have it. If you don't vaccinate yourself, you never know what will happen on the next day. You never know what will happen to you or maybe member of your family. So better to vaccinate and be protected from any diseases and any infections. So thank you very much for your time, and I'm really appreciate to able to answer and present this presentation regarding about human immunity. Thank you so much. Bye.